Hello there. Welcome. Thanks for joining us, everyone who's here. We'd love for you to say hi in the comments under the video, and so we can know where you're from and who you are, and see what kind of audience we have. Also, please add your questions in the comments and the chat. And we will not have time for questions today. It's just a short live video to tell you about Ayub and his work. But we will follow up with your questions on the Humanitarian Commodities Logistics Forum in the International Agency for Public Health Logisticians discussion platform. And so if you have any questions there, you can follow up and you can get information there. So JSI has conducted a series of blended learning, webinars, technical discussions, as well as in-person workshops on managing health supplies in humanitarian settings. And these trainings were sponsored by the Building Capacity to Improve Pharmaceutical and Medical Commodity Management in Humanitarian and Disaster Settings program. It's funded by USAID's Bureau of Humanitarian Assistance, and the program supports BHA implementing partners to improve supply chain practices in their crisis response efforts. Mr. Ayub Musa participated in one of our trainings, and we've been working together for a while, and we've learned a lot about the great things he has done to improve the supply chain management. And so we wanted to interview him here today so you can learn more about him. Uh, Mr. Ayub Musa is a young public health practitioner and is currently working with the United Nations Relief and Works Agency for Palestinian refugees in his capacity as a medical supply chain coordinator. Mr. Ayub is mainly responsible for quality assurance matters in his organization and stock level monitoring in 140 health centers across 5 countries in the region. UNRWA operates in Jordan, Syria, West Bank, Gaza, and Lebanon and serves over 5.5 million Palestinian refugees. Ayub is very dedicated to his work and making sure that the people he serves get the products that they need. So, Ayub, I'd like to ask you a question. We want to learn more about what are the circumstances of the humanitarian crisis you work with, and how does the impact of the supply chain to deliver medicines to the last mile relate to these disasters? Thank you so much.
Thank you so much, Nadia, for this opportunity. I'm glad to be here. As you have mentioned, United Nations Relief and Works Agency for Palestinian refugees works for around 5.5 refugees in 5 distinct regions. The overall humanitarian situation in these 5 areas is burdened by, let's say, very dense refugees presence, particularly a significant number of Syrian refugees and Palestinian refugees. This is the unprecedented humanitarian situation that we are faced with and has a strong impact on the medical supply chain. For instance, Syria is in a protracted crisis with a weak infrastructure, let's say that impacts local availability, importation, delivery, storage, and distribution of medicine. While UNRWA can reach the last mile, overcome let's say, the power supply issue to maintain an optimal cold chain and serve provision, that remains a big challenge even for the United Nations organization. So this constrains, the decentralized storage and in many remote areas, stock out of essential medicines are impossible. Also, Lebanon is another such example where political turmoil has impacted badly on the availability of medicine locally. Even commercial sector is running out of basic medications. In such situation, the pressure on supply chain is enormous. Also, Gaza and West Bank, as you know, let's say, have a specific regulatory environment that makes the delivery of medicine challenging. Over to you, Nadia.
Thank you. Can you tell us, that's a very complicated reality in which you work. Um, those are a lot of co-occurring challenges happening at the same time. Can you tell us about those challenges in your supply chain, in your day-to-day work, specifically delivering pharmaceuticals to the last mile? Thank you.
Thank you, Nadia. I have touched upon some challenges in my previous answer. So, let's say we have to identify some key challenges that we face. So, I will say that the main challenge we face nowadays is availability of pharmaceuticals in local markets due to COVID pandemic that has restricted international trade in the past couple of years. A chronic issue in this region is a humanitarian crisis due to the political situation in the region. That impacts our day-to-day work in a way that we are faced with several supply chain bottlenecks, such as long lead time, lengthy import procedures, local FDA approvals, and other compliance issues that are not possible concurrently and hence to have to follow one another. This makes the lead time extremely lengthy, and we must plan way in advance for the next procurement cycle. So basically, we plan at least 8 months ahead of placing orders. The next issue, which may be more specific to the organization I work for, is tracking stock levels. We have electronic medical records that are used to keep stock level. However, the decentralized pharmacies at 140 health centers need to be linked and synced with the central warehouse. We are currently monitoring the central warehouse work through SAP, Enterprise Resource Planning System. The EMR and the SAP requires integration, which is not yet complete. In absence of such a solution, so we have developed an intermediary tool using Excel sheets that ensure appropriate stock level monitoring and links to system temporarily. Thanks, Nadia. Over to you.
Thank you. I think this is a great example of in humanitarian emergencies. Sometimes the situation is not ideal, so you have to come up with temporary solutions to keep things moving. So this is wonderful. Can you tell us about some of the solutions you've created to ensure that medicines are available in the populations that you serve?
Thank you, Nadia. But first, allow me to share the dashboard. Can you see it now?
Yes, I see it. Thank you. I'm sure everybody can see it too. Thank you so much.
So, as I mentioned in my last response, the tool was created as an ad hoc solution to the lack of integration and availability of real-time data. So I used Excel to create a spreadsheet that extracted information on stock levels from EMR and SAP and then a formula to project existing stock life. In addition, this Excel sheet links the pipeline using expected date of delivery and quantities ordered to the current stock level and gives us stock life, including stock on hand and the pipeline. This way, the agency can plan better for mixed procurement cycle and avoid any wastage of resources.
Thank you so much. We know in emergencies, sometimes wastage can be a big problem because we may overestimate the number that we need. And then supply planning is so important to do that, which this tool has helped with that supply planning. So you not only are quantifying your need, but you're also planning when to conduct your shipments based on that demand. And in lieu of having an integrated information system, you develop something that could work in the meantime. And it's a great example of how to respond under pressure. And we know you created this yourself, Ayub, so it's very impressive. I think this is what's so remarkable about people that work in under this kind of pressure. They find these solutions to help the people. So I just want to thank you and everybody in the audience for listening. And I want to remind you that you can get more recorded sessions about our work on YouTube. You'll see the link in the comments. And also, you can continue to be a part of this project and all of these solutions by participating with us in the Humanitarian Commodity Logistics Forum of the International Agency for Public Health Logisticians. There you can ask for your questions and answers and find a lot of material. And we all want to really thank Ayub and UNRWA and all of the humanitarian partners, NGOs that participate in this project, as well as USAID, Bureau of Humanitarian Assistance, who supports this program. Thank you so much. And thank you, Ayub, especially for your time in such a busy environment. Thank you.